Hey, how's it going? This is the end of day 5, Wednesday, April 29th. 2 days left. 5 days in a row. I'm not gonna lie, I'm getting tired. I think I've been staying up too late still on California time a little bit, and I'm not going to bed until after midnight. We're getting up in the morning and doing our thing, and the hours aren't terrible. It's probably 8:30 to 5, and but it's busy and it's stressful, and there's definitely a little fatigue setting in. So trying to recharge a little bit, stay focused, put in the last 2 days of good work before flying out Friday night from New York back to San Francisco. A lot of the emotional ups and downs are kind of leveling off as kind of adjusting and seeing what the game is and what the rules are and playing by that. But met a nurse today who, you can talk about my fatigue at day 5. I think she was on day 11 in a row, and she's one of these nurses that took this gig that's $10,000 a week. I'm here volunteering, making $0, and they're getting $10,000 a week, but it's 21 days straight, which is nuts. And like I was saying before, they are on the front line more than I am, more exposed, so they do deserve to get paid well for their important work. But I'm whining on day 5, and she looked pretty good at day 11. 10 more days like that, and these nurses work hard. I think our work is more mental, is more in front of a computer, is more kind of figuring out plans, and they're slinging meds and moving patients in and out of, they're at the bedside taking care of patients. So props to them. Now that we've been on service for a few days and have gotten to know my patients, and we've kind of put in some plans, it's definitely like a ship. You're steering the ship, and after a few days, it's encouraging when you can see improvement. And we've had several patients that have improved, and a lot of it, I think, is due to, not dramatic, big, sexy things that we've done in management, but just the little basics. And I had said this before about how, a lot of times it's carrying the mail and watering the garden. You do the right things a little bit at a time, and you let people get better. And it's nice after 5 days to start seeing that. In my mind, I kind of imagine 3 kind of groups or classes of patients. Number 1 are the ones that are getting better and they're going to be fine. And we have a few of those on the service. These guys tend to be younger with less medical history. By the time they come to us, they're rapidly improving. They're coming off of oxygen. They're, perked up in bed, eating, walking around. And it's just a matter of getting them off those last couple liters of oxygen to where they can go home without any oxygen, because there's no portable oxygen. This area is out of home oxygen tanks. So if people need oxygen, they have to be in the hospital, or they have to be in a nursing home or a skilled nursing facility, because there's no home oxygen to be given. But anyway, there's this group of people, and we got a few of them who have turned the corner. They're over the hump. They're, whatever your analogy is, they've rounded third base and they're heading home, and they're going to be fine. And I don't know that what we did made much of a difference. We're kind of, we kind of got the ball on the 10-yard line or the 2-yard line or whatever you want to say, and you knew you were scoring with that one. Those guys were going to be fine. That's one group. I've talked a lot about the other end of that spectrum, which is the group of people that have a really terrible prognosis, and if we call it what it is, are dying. And for those folks, even when you do everything, it doesn't reverse or change the big picture of what's happening, which is people are dying. And there's a couple in particular 2, and unfortunately we added another one today to that crew, who day to day they're on maximum meds, the right antibiotics, blood thinners. We're taking care of their blood sugar, giving fluids, managing all of these aspects of the patient and their condition, yet every day they get a little bit worse. Their mental status gets a little bit worse. They're less responsive. Some of them have fevers that get higher. Their, oxygen needs, instead of going from, 4 liters down to 2 liters off of oxygen, they're going the wrong direction. They need more and more oxygen. 4 liters to 10 liters to a mask, to BiPAP, which is a form of, kind of ventilation, a ventilation machine that's not the tube down the throat. And so there's these guys that, despite doing everything, we see them slowly getting worse. Sometimes they kind of tread water for a day or two, but when you kind of take that step back, you can see they're slowly getting worse. One patient, for example, yesterday could barely talk, and today just even less. Yesterday looked, I would say, relatively comfortable breathing. Today, is just struggling a little more to breathe, so it's like struggling to breathe, mental status getting worse, not eating, any, all of these things are pointing in the same direction. And then you look at the objective things like the chest x-ray and the vital signs and the lab results, and they tell a similar story of a patient getting worse ultimately and dying. So that's another group of these 3 groups where, despite doing everything, these guys are dying. And I've talked a lot about the importance of this week in communicating with family where we're at, making sure we understand the goals of care so that we're doing right by the family and the patient. And I've got my opinions on chest compressions when people pass. I've talked a lot about that. I just don't think it's the right thing, and there's a dilemma in there. And then also I feel very, very strongly about families being able to see their loved ones in the middle of this pandemic in the hospital as they're dying. I think they should see them anyway. I think we need to figure out a way for families to be with patients during this time. I think it would be therapeutic. I think people would do better less isolated. And I would really challenge the infectious disease community and those folks to figure that out, because this situation now is just disgusting. But there's this third group of people who are potentially could make it. Gabe and I call it salvageable. You feel like, these are the ones we really need to dig in on, do our best medicine and give them their best chance to survive. And they could go either way. I mean, those are the ones that matter. And it's not everybody on the list, I don't know, maybe a third of them, but we've got a handful of those guys. And we definitely dug in on the first couple days of the service, and now is day 5, and it's really gratifying to see. I can think of 2 or 3 of them in particular. I'll tell you about them a little bit. One guy, we came in and he was just confused, lethargic, just his eyes were open, he's just kind of looking around, not talking very much. He wasn't happy. His belly, he'd been sick for a long time. He'd had COVID, corona complicated by liver problems, or not liver, complicated by kidney failure and infections, and then his intestines shut down and his belly swelled really bad. It was kind of constipation. It's called megacolon, but he had this, it wasn't quite a blockage. It was just like his large intestine was super distended with air because his intestines weren't really working. We call that ileus. So this guy was miserable, and he's kind of teetering, like he could go either way. And his electrolytes were all screwed up, and his blood sugar was out of control. And so, one by one, we start getting those things in line, giving him the right fluids so that his electrolytes, like his sodium, is balanced. We're doing the right thing for his kidneys. Controlling his blood sugar, giving him the right amount of insulin to lower that, because that makes everything else complicated. Giving him enough laxative and stuff to poop to try to get things moving. And slowly, sometimes you can barely tell the difference day to day, but by today, I went in there and he was perked up, eyes were open, sitting up in bed, he was talking more, he wasn't irritable, he was in a better mood, his belly didn't hurt as bad, it wasn't as distended. I said, okay, let's take the next step. Like, let's get this guy up, get him out of bed, move him, walk him, get him into a chair, get him to feel more alive and active and moving, and just not like sometimes we just sit in bed thinking that bed rest is the best way to get better, and it's not. Just like your body shuts down when you get up and move, like that movement is just associated with life, and I feel like it helps things to come alive, including your intestines. But it was really cool to see him today. Again, this is like this ship, you keep going. You keep it steady, you go straight, you do the basics, and you give people a chance. And this guy, the last couple days, especially today, I really felt like he got better. Now, he could take a turn, right? He could still go the wrong direction. He's not out of the woods. But he is going in the right direction, and I'm hopeful and optimistic he will continue to do so. And we'll make it, and we'll survive this. So that was really cool. There's another woman that I'm thinking of in particular who, same thing, they all have corona, they all have COVID, and she had various other complications, heart and lung disease, diabetes, kidney problems. She's on dialysis. I mean, all these guys, so many of them have kidney failure from this coronavirus. And when I first came onto her, she was on a ventilation machine called BiPAP, which is, I thought, a no-no, but we do it a lot here, and I understand why. It's because there's just not enough beds and vents and everything for people to be ventilated, and there's concern that people do worse when they're ventilated. I think that's controversial, but anyway, when we got her, she was on BiPAP. I want to say like 60 or 70% oxygen. One of the ways you gauge if somebody's getting better is you're able to turn down the oxygen. So let's say one day they're 60%, the next day is 50, 40%. If they're able to tolerate that, you're going in the right direction. If they're getting sicker, they often need more and more higher levels of oxygen. It's just one way among many to, quantify how they're doing. And so, first day she was on BiPAP. We were able to get her off of that onto 15 liters of an oxygen mask. And then that came down to 10. And I think now she's somewhere in the mid, whatever's still on a mask. We were able to get her up. She walked. Her oxygen dropped, kind of predictably, because she's still tenuous. She's still kind of, recovering. But the point is she's going in the right direction, and kind of looking at her, she looks good. So that's encouraging, like she's making it. So those are really encouraging. A lot of the discussions and stuff, the media and everything has been about ICU care, intensive care unit care, mechanical ventilation. Do people survive and get off the vent? There are various stages of recovery. So somebody may be in the ICU and on a vent, and they survive that. They get extubated, they're off the vent, and then they go out of the ICU having survived the critical illness of coronavirus, of COVID-19, and they go to the floor. And the floor is like the next stage. And so you continue to improve. And this stage is basically getting off of oxygen. That's the main thing. Getting off of IV medications, whether it's IV antibiotics, IV fluids, all the things that we give through an IV. Because in order to go to a nursing home or to the next stage of recovery, like a rehab facility, usually you want to get off of those things. And so, the conversation has largely focused on the deaths, which we call mortality, the death rate, the total number of deaths, and that's absolutely, probably the number one number on the scoreboard is how many people are dying from this. But there's another aspect of this that I want to talk to you about, which is the people that survive, but then they're disabled or they're debilitated. The easiest example of this, not during COVID pandemic, is a stroke. So when people have a stroke in the brain, and they develop, let's say, right-sided weakness and end up in a wheelchair, they don't die in that hospitalization, but they do lose a lot of function and end up disabled and needing to go to, rehab in a rehab facility or nursing home. Sometimes, a lot of times people do a temporary stay, a matter of weeks in a rehab facility, and then they go home. And sometimes folks end up permanently needing to be taken care of in a nursing home if they're bedbound or if they're in a wheelchair and appropriate care can't be arranged at home. And so we've been talking a lot about all the folks that are dying, but what I'm seeing is, and we've talked a lot about the people that die, but there are a lot of people that survive, but they are so incredibly weak. I mean, one guy is this 40-year-old diabetic, and he's coming off of oxygen. He's still stuck on 4 liters. Like, it's hard to get him off of that. I think he's going to be fine and recover, but he's having problems walking across. Like, he can barely get up and walk to the bathroom because he was intubated for a week and not moving in the ICU. Like, his body is so incredibly weak. He has to rehab to get back to his prior level of function, and he's 40. I had another guy that was in his 50s who was an appliance delivery guy. I mean, this guy a couple months ago was delivering refrigerators, unloading them from a truck, hauling them upstairs. He's a pretty strong guy, right? He got corona. He developed some respiratory problems and low oxygen level and everything. He ended up in the hospital for weeks. He can't go back to delivering fridges next week. Like, he's going to have a prolonged recovery period in rehab. And so, yes, there's 50, 60,000 Americans that have died, whatever the number is now. But of those that survive, and we want people to survive, how many of them are basically disabled and debilitated and needing so much continued care and rehab? And so stage 1 is like the hospitals are overflowing, the ICUs, there's not enough ICU beds, but then it's like at some point the nursing homes and the rehab facilities are gonna fill up, and that's gonna be an issue too. Now the other side of that is and this is very cynical and dark to say, but coronavirus is gonna kill a lot of people in skilled nursing facilities and nursing home and open up a lot of beds. But there's a wave of people who survive and don't die. That's mortality, but end up still suffering and having things they need to continue to recover from. That's called morbidity. And there's going to be an incredible burden of morbidity on so many people who came close, dipped their toes into the coffin, but then survive, but only to live. Like, what's their quality of life going to be? And I'm starting to see a lot of that here for the survivors. That's definitely an issue. Some people have asked me after listening to a lot of these talks and seeing how it is, especially young, healthy people, they're like, should I be afraid? And I have felt, so most of the people that I have seen that have been sick, I think we've only had one that was a 20-something-year-old young person who had no medical history. Everybody else had medical problems, meaning long-standing diabetes, chronic medical conditions that were not well controlled. Like, not like they'd had, high blood pressure for 20 years and had taken pills and had managed it really well and were in good shape. Like, we're talking about folks that had poorly managed diabetes and high blood pressure for decades. Obesity, people who smoked, drugs, alcohol, all these things, that make people sick. These are the guys that are really getting into trouble with this. Now, there are, of course, cases, there are some young people that do get sick from this, but it's less likely. Seeing this stuff that I have and looking at the numbers makes me much less worried for myself, even being on the front line and being exposed like this. As long as I take care of myself and I don't get too burnt out and rung down, I'm going to be fine. And I think that's probably true for most of people anywhere close to my age, 40, younger, in good shape. Now, once you have things like diabetes, if you're 300 pounds, if you smoked a pack a day for 30 years, that changes the game a little bit. That's a risk that does bring some problems. Well, so what would I say about that? Stop smoking, stop vaping. Whatever chronic medical conditions you have, high blood pressure, diabetes, etc., get those under control. It's only going to put you in better shape if you do get this thing and get sick. Who are the people to really worry about? Well, the people who are 70, 80 years old and have, advanced diabetes. So, you've got diabetes, number one, and then diabetes that has caused kidney problems and heart problems and vascular problems in your legs, all of the complications from diabetes like that. Those folks are the ones that need to be very, very careful not to get this thing, because they are the ones that are at high risk of getting complications and dying. Age and that kind of medical history. You got a little blood pressure, if it's well controlled, not that big of a deal. On the other hand, 30 years of diabetes where you're blind, you got kidney failure, you have a heart attack from diabetes, like those guys are the ones that are really sitting ducks for this coronavirus. Corona loves to come by and gobble them up. So I think for the average young person, you have less to worry about for yourself, but more to worry about for old folks and the sick, and those are the people that we all need to protect and think about as we're wearing masks and going outside and going about our daily lives with all these recommendations. Whatever the local authorities are recommending, in general, that's what people should do. Here in New York, the ethic is if you go outside and you're going to be closer than 6 feet to people, you wear a mask. But if you're going to keep distance, it's okay. And outside, 6 feet distance, then you can go on a jog. You don't have to wear a mask. Inside is mask time, and that's to prevent you from giving it to somebody else. Masks, these regular surgical masks don't do a ton to protect you, but it does keep you from potentially exposing other people. That's kind of the point of that thing. I want to talk a little bit about politics here. Some of this is very dark and cynical, but it just needs to be called out. A lot of these, this is a crazy idea, but it just needs to be verbalized. If you look at coronavirus, it is disproportionately killing black and minorities. And so, if there's a 15% of the population in Louisiana or Michigan is black, it's like over double of the deaths are. So like 15% is black in the population, but 30% of the deaths from coronavirus are in black people. That's incredible, right? And so you look at all these states, especially in the South and in redder states, that are opening things up, and you go, well, wait a minute, if we open things back up, like, people are totally going to die. That's not the right thing. We need to do it in a calculated way where there's appropriate social distancing, contact tracing, enough testing, etc. There has to be a really good plan as this goes forward, and I think a lot of these places, frankly, don't have that. But what's going to happen is people are going to die. And who's going to die? Well, it's going to be disproportionately black and minorities in those places. In other words, in the Republican-controlled areas, minorities are going to die more, which means they're not going to be able to vote in November. That's awful to say, and it just makes me pause about how cynical that I'm even saying that to you right now, but I feel like this needs to be called out. There are certainly different ways to approach how to manage this virus. Sweden is taking a much more liberal, if you will, approach, not home quarantining, but trying to maintain a social distance, having people be responsible for it. But I do think it's important also to acknowledge how that might play out if a large amount of minorities die politically. you could see how that could potentially favor. Isn't that awful to say? That's not the right thing. My God, that's not the right thing. I haven't looked at what individual states are doing or all these plans or whatever, but there's these Bakersfield guys, urgent care guys, that were just completely insane, and really should be cited by the medical board for that bullshit that they put out there. Unfortunately, just because it's an MD doesn't mean that it's trustworthy. So yeah, there you go. That's my summary for today, day 5. Getting a little bit tired, getting weary, but we're not going to quit. Now's not the time. We've got a couple days left. We're going to put in some good work in the next couple days. And it's been good. I feel like we've been giving good care. Got some good feedback today. The residents have really appreciated a lot of the teaching that Gabe and I have done. We discussed out-of-hospital cardiac arrest today, kind of what to do in those cases, how to think through that. Did some bedside echocardiogram training with the residents, got their hands-on training where they got to put the ultrasound on the patient and put it in the right places and kind of look at different angles of the heart. I showed you some of those pictures on Instagram stories yesterday, and so it's felt like we've done good work, and a little weary. I'm gonna go to bed early tonight, try to get a little more on New York time, get up and ready to roll, and finish strong. I've been proud to be a part of this and to serve in a really meaningful time. It really brings me back to remembering all of this value of service that kind of started in Catholic high school and service projects in college, but really kind of giving yourself to a cause, and how it's good for the world, but it's also good for you. It's good for me, to feel good and to feel like you've contributed and been a part of something is inspiring and exhilarating, and I think it is one of these things that gives back to you much more in life than you give to it. I mean, for the rest of my life, I'll be able to feel good about having come here and having given of my time and kind of put my neck out there a little bit to care for people in our country in the middle of this thing, and that's priceless. I'll carry that with me for the rest of my life. And this is not I don't think altruism is we're human beings with mixed motives, and I don't think there's anything wrong with doing something that you're going to feel good about for the rest of your life, that nobody's going to be able to take away. That's felt really good and been meaningful, and so there you go. Let's finish strong. You take care of yourself, including your mental health. Watch out for those in your community and your family, especially those who are older and who are sick and need to be protected, and please advocate for them. Speak up for them. What we should be doing in society needs to absolutely stand up for these guys that are the most at risk and vulnerable of just being gobbled up by corona. It is nasty shit that isn't going to take out the young, but it is going to take out a lot of us, and so it's really important that everybody be willing to stand up for those guys and to stop the powerful, the business, the young and irresponsible, those who want to fire up the economy at the cost of people's lives. Those people need to be stopped. There's no reason that we can't restart the economy with a very calculated, careful, minimizing strategy instead of just opening it, knowing and really not caring that thousands of lives are going to be lost. That's bullshit. It needs to be called out, and I want you to be a part of those who stand to protect the weak. Because we need a lot of that right now. Those voices are not being heard. This damn thing is not going to go away in a couple of weeks. It's going to be with us for months and probably over a year. All right, take care of yourself. Tune in next time. See ya. Thanks for listening.